every January we have what's called a Super Bowl of Safety, and it's a partnership pulled together by the Coalition for Childhood Safety, many different agencies in the community. The Packers are very involved. It's offered in the atrium. Great event, just very well attended. All kinds of different agencies that are zeroed in on childhood safety. Very excellent program. In April, there is an event called the Big Event for Little Children. It's a service league, an Encompass daycare offering that has a wide variety of issues of interest for children, including some of the safety things that are offered at the Super Bowl. Bellin itself partners with the school districts, and this has been a very interesting experiment over the past half-dozen years. We have the Bellin Run. We all know that event, but what you may not know is that in the area of 2,500 of the 12,000 participants are children in grade school. And we've partnered with the various school districts in the area, working with the Phi-Ed departments, putting together an organized way of training youngsters in how to run that type of event. They're out there every day on trails and streets. They wear their t-shirts, they come as a team, and unfortunately many of them come running by me and they're about this high and their legs are going a mile a minute. So obviously a very good event to stimulate children to exercise. So those are the kinds of things that go on in this community, in this whole region. All of us are involved in them. I think you can see how we do leverage our resources in a very positive way. So what's the vision? The vision, for me anyway, is that we're spending billions of dollars on health care. We're fighting with the governor, trying to wrestle dollars away from many of your agencies, your school districts, whatever, because we need more money for Medicaid. We're just trying to wrestle money from different sources, and the healthcare industry consumes so much money. The money is there. The money is there for us to shift to other purposes, and we have to figure out how to get to it. And the way we're going to get to it is not revolutionary. It's pretty basic. The revolutionary nature of how we're going to get to this is the fact that it requires every individual, every child, every adult to recognize that you're responsible for your health. You're responsible for knowing your health condition. You're responsible for making sure that you do basic things to maintain lifelong health. And if you maintain lifelong health, you're going to shortcut all the dollars that we spend on acute care services that are unnecessary and that are wasted. So that's the overall vision. And let me apply it to children and to young people. And I want to go back to what Nancy talked about. This community partnership for children, Nancy described it. We've got a fixed number of children being born in the community every year. And there are a few kids that are born in haystacks in the backyard, but the majority of the children are born in our hospitals. And there are only, there are only a handful of hospitals in our community. So if we can effectively get in and assess those children, those environments in which those children are being born, and put the resources into those households early on, that percentage of children that don't have the positive environments, the nurturing families, and the health care offering that they should have, can be identified, and we can work with them to make sure that they are able to develop healthy lifestyles starting on when they're born. So that ability to identify every single person starting at some point in time, let's start in 2008. We're going to start in 2008. We're going to start identifying every one of those children, and we're going to work with them and do that year after year after year. That's a very, very powerful tool to use And eventually, I think people can understand how that can really be positive. So that's one approach for literally identifying every person born in the region as we're moving forward. The second way is what I talked about earlier, and that's that we need to be responsible for our own health. And I'm pointing my finger at everybody here because that is everybody. You're consuming dollars that in healthcare, and your companies and your employees are consuming dollars in healthcare that should be going to these other initiatives. And if you take responsibility for your health, understand what it means to take responsibility, which you will be given the opportunity to learn about, the cost of healthcare within your companies and agencies will plummet, and you will have, and we will have, the resources to devote to these other initiatives. We're going to apply this concept, and we're going to apply it to people of all ages, including some of Dan's students, and we're starting at Southwest High School. And at Southwest High School, we're going to stimulate that student body and identify within that student body a system to create an environment to have health care be a hot topic, to be as hot a topic as some of the more negative topics that are out there. We want kids to know what their health risks are in their age group. We want to measure them. We want them to be trended over time. We want them to talk about what's going on. We want to give them the resources to maintain a more positive health. We want them to get off their butts and get out and exercise. And we are going to do that, and we're starting with Southwest, and we're going to spread that throughout this school district and throughout other school districts. So that's the vision. The vision is we want to create an environment where there is greater lifelong health for our children, for us as adults, for our parents and grandparents, for people of all ages. But when we do that, we'll have the resources to plow back into the programs that we talked about today. So thank you.